G'day everyone, welcome back to the channel. So what we're going to go through today is I want to show you the most effective way to use a lacrosse ball or a tennis ball to mobilize restrictions and stiffnesses in the neck and upper back. Now it obviously goes without saying that the lower back still applies to this video, but for the context of what we're going to go through, the upper back and the neck are probably better just to touch on their own, but please apply this to the lower back as well. What we're also going to touch on is I really want to go through a common misconception of how people do this exercise, and it tends to make the exercise far less effective than what it should be. And then after that, we're just going to go through a really quick progression for those that are doing really well with the exercise and want to get a little bit more out of it. So hopefully the video won't be too long, but there's a little bit of information that I want to touch on. So getting right into it, the common misconception about this exercise is despite using a ball, we don't actually want to roll around on the ball to get the most out of it. I think that's most people's defaults, where we grab the ball, we put it in somewhere, and we're trying to sort of roll that ball around, trying to pancake some of that tissue away. I guess in the idea of giving it a massage, trying to massage that tightness away. Now that can certainly help, where those muscles can feel a little bit looser afterwards. But if you want to see a really distinct change in a short amount of time, we actually want to just keep the ball in that spot and just let it sink in. So the way to do this is you want to find a spot basically. You start in the middle of the upper back, and then basically we want to start on the spine in the middle. We want to roll straight off to one side. And what we want to take note of is we want to take note of how tight, restricted and stiff that area feels. We want to see how well the ball sinks in, and then we want to compare it to the exact same spot on the other side to see which side is the most restricted. So for me, it feels a little bit more stiff and tight on the left hand side, so this is where we need to be. Now you'll notice that I haven't talked about pain or tenderness yet, and that's because it doesn't matter as much for this exercise where it hurts, because that's, if you want to think of that as the symptom, that's very important in its own right. But if we're trying to solve why that symptom is there in the first place, we want to look for where those restrictions are. So for example, probably about 50% of people, maybe 75% of people will have their soreness and their tenderness on the same side that feels stiff and tight. That's okay, it makes this exercise really straightforward. However, for the other group of people, they're going to have most of their pain and tenderness on the side that doesn't feel that restricted. And the reason why that's really interesting is because we actually want to be on the side that feels the most restricted, not the side that feels the most sore. Because the way the body works is, if I'm really restricted here on this left-hand side, I'm pulling slack or I'm pulling function from everywhere around it. So that can be the other side, it can be above, it can be below. Depends on how you're structured and where that restriction is. But if my shirt tore here, for example, then if I kept repairing this side, but I'm not taking away where all the extra tension's coming from, so I'm not taking away that restriction to restore normal function to my shirt, then I can't solve the underlying cause of why that's become painful in the first place. So a really clear rule for this exercise is look more so for the area that feels the most stiff, that doesn't sink in as well, that's the most restricted, not the one that feels the most tender. So it can be the same side, which is easy, but sometimes it's not, which is why you need to double check on both sides. And the other important thing about that is that generally the restriction stays on the same side for a long time. It doesn't go from one level to the next as you work your way up and down. So for me, if my left-hand side's a bit stiff here, there's every chance that the left-hand side of my neck is going to be a bit stiffer, and most of the way down my upper back is going to get stiffer as well on that left-hand side. But if it does change to one side, generally it then follows the same pattern on that same side, because often what it is a consequence of the shapes and the postures that we get into. So it's really important that you're really not seduced by where the pain is, but you're looking for where the stiffness is. So again, for me, it's on that left-hand side. And the way that we want to do the exercise is really simple. We just want to find a spot that feels really interesting and stiff, and then we literally just want to let the ball press in. So we want to keep it there for about 30 seconds, for a minute, 2 minutes, depending on how restricted it is. If it is a little bit tender, if it is really stiff, a great way to speed up how quickly those symptoms go away is just to do some relaxed deep breathing. So just take a deep breath in, and then keep trying to sigh on the way out to really allow your nervous system to feel safe, allow it to relax, so it allows those tight restricted areas to give, allows those sensitized areas to become less heightened, less sensitized, so ultimately to free up that area as quickly as possible. So again, it's easy to do this on the floor, but if you're doing it up against a wall or a chair or anything like that, it's also fine, but a floor works better. So once you've had enough of one spot, all you want to do is just move it up a little bit, move it down a little bit, or move it a little bit closer to your shoulder blade onto the rib cage, and go looking for the areas that you feel are the most important. So it's very specific to you. It's very specific to what you feel, but just make sure you're looking for the stiffness and the tightness and the restriction, not just where it hurts, because you can be missing some really important low-hanging fruit going forward. So that's basically the exercise. It's not very interesting on the surface, but it's really, really effective. So making sure that you find those stiff spots, stay there for a period of time until it frees up. Do some deep breathing, some relaxed deep breathing, just to allow those tissues to give a little bit faster, allow that sensitization to desensitize and feel less tender, and then just move it along, up and down, depending on where you feel you need to be. Now, if we're doing it in the neck, and the reason why I wanted to include the neck is that it's slightly different technically. So the same idea in that you want to start in the middle and then roll it off to the side, but sometimes the ball can shoot out quite easily when you do this. So the little hack, I guess, that you need to do with this is you want to start in the middle, then turn your head gently to the side that you're on, and then move the ball around until you find that stiffness. So you're basically just allowing the ball to be perched on the bony column of your neck, and it makes it easy to dig the ball in and to keep it there for a long period of time. So again, we're looking for stiffness and tightness. Compare it to the other side. Maybe this side feels a little bit tender. It doesn't matter because this side feels the most stiff. I'm just going to stay here until I feel like it goes away, or at least gets a bit better. So you can spend 10 minutes doing this. You can spend an hour doing this if you're on the floor watching a good movie. But the goal is that you should feel immediately looser before and after. After you've done this, so you can compare before and after to make sure that you see that. So that's the main idea behind using a ball to free up the spine. Again, the same thing applies to the lower back, it's no different. But for those who want to get a little bit more out of this, what you can do, and this generally applies to the upper back, and it's really, really simple. So again, once you've found your important spot, what we're looking to do is we want to get your arm into this to free things up a little bit faster. So a lot of people don't realize that in order to have normal shoulder function, you've got to have normal upper back function as well. Because that shoulder blade sits on top of your upper back, and any arm movements that you do require your shoulder blade to slide and roll up and down depending on what you need to do. So if you're a little bit stiff because something's restricted, then your shoulder's not going to move as well as it could, so it's going to jam up a little bit more, and is one of the leading causes for a lot of the shoulder pain that we see in most patients. But the interesting thing is, by finding a stiff spot and then gently lifting your arm up as high as possible, we want to get you to oscillate in and out of that end range to really shear free that stiffness as best as possible. So for me, I find a really good spot just here near my shoulder blade. It's a little bit tender, but it also feels really restricted. So this is as far up as I feel comfortable going without it feeling too sore. But the really great thing about using your arm is that the more you do this, in no time at all, you'll see that the arm just keeps going further and further back. So we're using movement to shear free that stiffness and tightness through the rib cage, through the upper back. And in no time, I can start touching the wall that I'm leaning up against. So it's a really great way to make the exercise even more effective. Obviously, if this is too tender for someone, then you can use a tennis ball, which is a little bit more gentle, obviously. Then if it's also a little bit too sore, you can regulate what surface they're on. So if someone's on the floor on hard wood, obviously it's going to be harder. Carpet is better. If it's still too sore for a lot of people, you can lean up against a wall. It just makes it easier to free tissue up if it's not too tender. So that's essentially the best way to do the exercise. I completely understand that rolling is a common way to do it, but when we're trying to make the most effective change in the shortest amount of time, staying on the one spot for a while will definitely free up a lot of that trigger point soft tissue-y stuff, but it'll also start to capture some of that deeper joint restriction, which a lot of people neglect and completely overlook because they're glossing over the surface with the ball. So hopefully that was helpful. Let me know in the comments how you go. In the meantime, I hope that helps, and then we'll see you next time.